Morning. Hi, everybody. Welcome to the water cooler. My name is Nichele Hoskins, and I work with Healthy Savannah. And we are excited to have two guests to discuss COVID flu, both from a medical perspective and a community perspective. And so I would like to briefly introduce the guests, and I'm hoping that they will expand on their bios for us. Ms. Kathy Jenkins serves as one of Healthy Savannah's community health advocates, and Bonzo Reddick, Dr. Bonzo Reddick, is a family physician at J.C. Lewis Primary Health. But before we start, though, I do want to acknowledge the passing of a figure, an important figure in our city, Pastor Matthew Southall Brown, and wanted to ask Dr. Reddick if he had anything he wanted to mention about the pastor we both grew up with.
Yes, kind of a spiritual father, mentor, kind of the closest thing I had to a grandfather after age 5, when my second grandfather passed away, and just the father figure to my father. Grew up in that church, friends and family, and just all kinds of memories, and just real sad to hear about his passing. I guess we all can't live forever. He lived a full life, service to his country, to his community. My sincere condolences to all his family, all his grandchildren who I was, grew up with and played with as a kid. And just, he's going to be sorely missed by the community, by all his friends, by all the people who knew him as their pastor. And I'm just real sad to hear about his passing.
Yeah, absolutely. My father and Pastor Brown were very, very close. So and I think your dad was a deacon as well, wasn't he? Yeah.
He was the vice chairman of the trustee board for I don't know how long, 20 years or so. Yeah.
Oh wow, yeah. So I just wanted to mention that, and then let's start into this discussion about COVID flu. First of all, Omicron. What can you tell us? What can you tell us about Omicron? What do we need to know, and what do we know already?
Mm-hmm. Yeah, so thanks again for having me this morning. So the variant that we're talking about now, the Omicron, some people pronounce it Omicron. I looked it up. Both of those are actually okay pronunciations. But like any viruses mutate. They change. Some viruses kind of don't are less resilient and don't mutate as much, but a lot of them do. The common cold virus mutates. The flu virus mutates. That's the reason why they have a new flu vaccine every year. That's the reason why you can catch the common cold multiple times in a year, because the virus just keeps changing. And so the coronavirus is acting just like other viruses have just all throughout history that we've known about, is that it changes. And so the new variant is the Omicron variant. The World Health Organization has chosen to name the variants after the letters of the Greek alphabet. And so the very first version was the alpha variant, and then there was the beta, and on and on and on. There's certain variants that have tended to be more newsworthy because they're spread a lot quicker. They're more virulent, meaning they kind of are more likely to make you ill. More dangerous, more likely to kill you, or just have a lot more mutations. And so the Delta variant was the one that really was in the news over the summer because it caused a really, really large spike in coronavirus cases. So if you ever see those little those graphics that show the increase in incidence of the coronavirus, you'll notice that way back in March of 2020 we had this little spike up, and then later on towards the end of the year we had another spike up. But then this past summer, there was this huge spike up. That happened with the Delta variant.
We do have a graph for that. If we could pull that up, not the bar graph, but the line graph.
Okay.
Which shows, there you go.
That's exactly, that's it. So this is Chatham County, but over the country, you've seen the same pattern everywhere. So you saw the initial spike up around St. Patrick's Day last year. And then it kind of started to come down a little bit when everybody learned about washing your hands, wearing masks, social distancing. Everybody kind of just stopped going anywhere. There was a big lockdown. Cases dropped. Things started opening up a little bit. You saw the cases spike back up again. The vaccine came out. The cases dropped. But then the Delta variant came out over the summer, and that's where that last huge spike is from. So
Okay.
the reason why the Omicron variant is kind of a big deal is we haven't seen quite that big of a spike, but there's a concern that we could with the new variant. The initial indications are that a lot of I know the physician who, the scientist who first sequenced the Omicron variant in South Africa said that a lot of her initial cases were relatively mild. The thing about the Omicron variant that has people concerned is that it's so many mutations on it. So with the Delta variant, there's been a few changes to the virus, but with the Omicron variant, there's way more changes. So the virus has changed a whole lot. The concern isn't as much that the Omicron variant is way more dangerous than the Delta variant. We don't have any evidence so far that it's more dangerous per se. But the problem is it's shown how that virus can mutate. So if it keeps doing that, eventually it could mutate into a form where the vaccine won't work against it. Right now, the Omicron variant is susceptible to the vaccine. So the vaccine works against it pretty well. But if this keeps up, as long as the virus stays out in circulation, it could get to a point where it mutates to the point where the vaccine doesn't work against it. And if that happens, we're back to square one.
Right. Well, Ms. Jenkins is, as I said before, she is a community health advocate, and she is among about 15 people whose role is to reach out into the community and take this kind of information to folks who may not already have the information, people who need, science-based data to make their decisions. So Ms. Jenkins, what have you seen in vaccine hesitancy? Are folks slowly migrating towards getting the vaccine, or are people still hesitant?
I see people with resistance still to the vaccine, but there are a lot of people that I know that have gotten it. But those with hesitancy, they feel like they have, valid reasons. The one person equating it with their cancer treatment, because there were side effects with that, and are very afraid that she may end up with some side effects that she wouldn't be able to get rid of, and that affects her in her everyday life, as the something she felt like the cancer treatment did with her her memory, and then I don't know if there's so much treatment with the pain in her arm that just doesn't go away, and it's probably been at least 20 years, and she's still, having these side effects. And then the one person that I do know of, the doctor had asked her not to get it because her medical doctor, because she has lots of allergies to a lot of things, including medications. And so she did not get it at first because of that. She has now received that, but with some side effects and sickness because of it right now.
Sure, Dr. Reddick, can you address her concerns? I mean, clearly there is good reason to be concerned. Everything has a risk. So could you talk a little bit about her hesitancy because of her cancer treatment, and the real yet small risk of heart inflammation as a result of the vaccine?
Sure. So those are great questions. So unfortunately, I feel like a lot of the information that we need, platforms like this are great, but if you look at a lot of times the things you see on national media, they're really things that are trying to just be provocative, or just to try to pit two different two guests that just argue with each other so they can get ratings. Because I feel like the media hasn't really done a great job about getting just basic information about the risk and benefits of the vaccine. A lot of times it's kind of pitting the anti-vaccine folks against the scientists, and they get in and argue, and that's it. Because if we had more information out, then hopefully people will be able to understand the likeliness of side effects with the vaccine versus the likeliness of side effects from the disease itself. So that's actually a reasonable concern that Ms. Jenkins just brought up, which is there a risk of long-term side effects from anything? You should always ask that question whenever you're receiving any treatment from a physician. In the case of cancer chemotherapy, we know what a lot of the side effects are because we studied them for years. Somebody I know, a buddy of mine, was treated for testicular cancer this past year. he was treated with a medication called bleomycin. We know for a fact that if you get treated with that medication, you may have a permanent effect on your lung function. And he said that when he was a marathon runner, the first, shortly after his treatment, he could barely run 1 mile. And he knew that was a potential side effect. It was an accepted side effect. He said, I'd rather be living with lower lung function than to be dead from cancer. So he accepted that risk. And thank God he's actually recovered his lung function for the most part. So he knew that was a risk. It got better. Some people don't always get better. We use that same kind of tracking with the vaccine. We follow cases. We see what the incidence is of long-term side effects. And the incidence of long-term side effects is extremely low. I've had thousands of patients, literally thousands of patients receive the coronavirus vaccine. And I've only had 2 people that had any permanent long-term side effects. And both of them related to localized pain in the area where they had the vaccine. One person has just pain at the injection site. One person's had pain down their arm since the injection. And that's it out of thousands. Compare that to COVID. For people to actually get COVID infection, more than half of them have long-term side effects that last more than 3 months. More than a third of them have side effects that last more than 6 to 12 months. So if you catch COVID, about 1 in 3 people have what are probably going to be permanent side effects from the disease. Compare that to less than 1% of people from the vaccine. So you're way more likely to get permanent side effects from COVID, the disease, than from the vaccine.
And so those permanent side effects of the vaccine could have something to do with how it was administered and not necessarily the vaccine itself.
Exactly. And that probably has more to do with how the injection was doing. Maybe the person's anatomy is a little bit different. They have nerves that are a little bit closer to the surface, or maybe the person injected a little bit too deep or whatever. So that very well may have been operator dependent for sure. And again, you're talking about take 1,000 people and you're talking about maybe 1 will have some kind of side effect like that from the vaccine compared to 333 from the disease. Like I'll take my chance with the vaccine over the disease.
Yeah. Well, and then what are some of those long-term effects of COVID itself?
Yeah. So the most common ones are effects on your energy level and then on your breathing. So kind of similar to what I described to my friend who had the chemotherapy for cancer, kind of where you just don't have the same wind you used to. So get tired, short of breath, just walking up a flight of stairs or just walking 1 block where you used to be able to run and all of a sudden you just get tired of breath, short of breath, just walking. Or just generalized fatigue where you can sleep 8-10 hours and you wake up and still feel exhausted. Real popular player for the Boston Celtics, Jason Tatum, he had COVID. He's an all-world NBA all-star player. And ever since he's had COVID, he never had a problem before in his life. But now he's had to use an asthma inhaler before every basketball game since he's had COVID. That's probably going to be a permanent side effect for him. It's essentially it's like it's giving him asthma from COVID disease itself. I haven't heard of a single case of that happening from the COVID vaccine. So, so I hope that answered your question. I kind of answered a few different things.
No, you did. So Ms. Jenkins, you've been out, as I said, you've been out in the community, but you've also been talking to your own family about the vaccine, and you said that you had some symptoms yourself. You are fully vaccinated, have not gotten the booster, right?
Correct.
Yes. Okay. So tell us a little bit about your encounter.
Well, I encountered it through my granddaughter. I picked her up that afternoon from school, and she developed a dry cough. When I first picked up, she didn't have it, but she could have had it, before I picked her up because she'd been in school around a lot of people. And so her mother tested her a few days later, and she did have the virus. And later on, she did take her, because she tested her herself with a kit she bought from the drugstore. But later on, she did take her someplace and got her tested because she needed time off from work. And it was indeed positive. So because I felt, sick and coughy, I went to my doctor maybe 3 days later and I got tested. And that was on a Thursday. And the following Monday, they said it was negative. But I also began to feel sick. Like I had a cold and stuff, but the nurse told me when I went there before I got the results, she said, just treat the symptoms that you have. And of course, that's what I did. And they said, but I did not have it, but I certainly felt like that. So, but what I did isolate myself, away from people.
Mm-hmm.
Those
So
amounts.
this is what I don't scare easily, but this is what is scary to me, that a person my age or your age who, I have comorbidity, so I don't, I will very likely, if I get COVID, I will have severe illness. But what is frightening is that little ones or others who aren't vaccinated will just come into your orbit, and perhaps, infect you with COVID. This didn't happen to you. So, Dr. Reddick, let's talk a little bit about how we might start the what I call the vaccination conversation, especially as Christmas is coming up. Family gatherings are either being canceled or they're being modified. How do you start that conversation before the family gathering?
That's a fantastic question. Ms. Jenkins brought up an example earlier that kind of ties into this, which was, there's some people who can't get the vaccine for medical reasons. They may have allergies or certain what we call contraindications or reasons they can't get the vaccine. And then there's also people under age 5 aren't able to get the vaccine right now as well. So part of the vaccination isn't just about protecting yourself. It's also about being responsible and protecting your community and the people around you. So you mentioned about if you're traveling, going to places where you're going to be around other folks, especially in close contact, within 6 feet of people, indoors, that's when it becomes even more important to become vaccinated. Because the vaccine doesn't just make you, when we talk about the vaccine working, the way it works isn't that it doesn't just 100% protect you from getting COVID. Every coronavirus has been around forever. Some people think it's new. It's been around forever. It's the second most common cause of the common cold. But the thing is, the vaccine makes you more likely that if you catch COVID, it's just going to be a bad cold. The way the vaccine works, the reason we say it works is because it makes you almost not possible for you to die or become hospitalized with COVID if you have the vaccine, assuming that your immune system works normal. The problem is you're going to be around people whose immune systems do not work normal. For people over 65, the immune function kind of goes down, so the vaccine is more likely to have breakthrough cases if you're over 65. For people that are being treated with things that suppress their immune system, the vaccine doesn't work as well. So somebody who's being treated with steroid medications for something like lupus, for people that have rheumatoid arthritis, for people that are undergoing cancer treatment, for people that are HIV positive, all those types of things, the vaccine may not work as well. So part of your vaccination and kind of the reason to be vaccinated is to protect your family members or friends or people you come into contact who are undergoing cancer treatment or who might be HIV positive or who might be on medications that suppress their immune system. So that's how I start the conversation. When people say, you know what, I'm pretty healthy, I don't have those comorbidities like you mentioned. I'm a 30-year-old guy, healthy. If I get corona, I'm not likely to die from it. I don't think I need to get the vaccine. Well, not just thinking about yourself, but thinking about the people you come into contact with, the people who can't get the vaccines themselves. So that's a lot of times how I frame the conversation. I have known people that have gotten vaccinated for that reason. And when they thought about it, they say, you know what, that's a good point. My kids are under age 5, so I guess I should go ahead and get it. Or, that's a good point. My mom's undergoing breast cancer treatment right now. Let me go ahead and get it. All right, I'll find out, get it. And that's the way I kind of frame it.
Mm-hmm. But that is at the root of the difficulty here, because a lot of folks some folks will do as you say. It's like, I got it for my mom, I got it for my baby sister, but some really don't see the beyond themselves.
Mm-hmm.
How do you work toward convincing them that it is about more than themselves?
Yeah. So sometimes one thing that's frustrating in medicine is that sometimes patients will not do what you think they should do, and you have to accept that. At the heart of medical ethics is what we call patient autonomy, which is the patient receives the information and they're allowed to make the decision for themselves. And that's kind of how we live right now. There are things that society can do if they feel that the risk of the disease and the pandemic is so great that they need to intervene in situations like that. They can do things like have vaccine mandates, or have rules that you can't enter without a mask, or have rules that you have to be vaccinated to work in certain settings around high-risk people. A lot of hospital organizations have done that, saying that you're around sick people, you have to be vaccinated to come work here. If not, you're gonna have to work remotely, or if we can't find a job to do remotely, you gotta find something else to do. And so those are things that people have done in those situations. And that's why a lot of places do have the mask mandates, have rules that you have to wear masks to come inside. especially if you're going to be indoors within 6 feet of people, then you wear the mask. So that's the next message I have with people. They don't want to get vaccinated. It's like, okay, are you at least doing the things to make you less likely to spread it to other people? Wearing your mask when you're indoors within 6 feet for more than 15 minutes, washing your hands like crazy, having hand sanitizer on you all the time. And then also just from a personal standpoint, if you don't want to get the vaccine, are you at least doing the things to make sure that your medical conditions are under control so that you're less likely to get really sick if you catch it? If you have high blood pressure, is that under control? Is your blood pressure at a great goal? If you're overweight or obese, are you trying to lose weight? Are you doing those kind of things? Are you eating a healthy anti-inflammatory diet? Are you doing all those things as well? The same things we tell everybody, about this business, but really saying you really need to be doing this for real if you're not getting vaccinated.
Right. Yeah. And we've noticed that people are not going to the doctor as often, and maybe they are, kind of slacking off on their normal preventive care. I went during Thanksgiving. I went to an event, not an event, but a gathering, family gathering, and that was not my family. But I was assured that everybody was vaccinated, and then when we got there, we found out one person wasn't. And we made some changes. Instead of having one big table, we had several different tables. But Ms. Kathy, you were saying that you're not going to have a big Christmas family gathering, right?
No, we're not. It's just going to be basically me and my daughter and my grandkids. So they'll pop in. So that's really going to be it. I do have a large family. I have a lot of sisters and a couple of brothers, and they're just going to do their own thing. But we did have a little gathering in October. My sister from Atlanta, she came in, but she just only every year we usually have a family gathering with the whole family, all the extended family, grandkids and stuff. But she came in and she had some food catered in for us. She just wanted us siblings to be together, and she said no one else can come.
Mm-hmm.
So it was just us.
She was a hardliner, which I imagine would be difficult. I was watching this go on around me. I was, again, a guest of another family, and they were it's very difficult to have these conversations. Any advice from either one of you of how to start, where to start?
Well, like I said, every year it's just been postponed, the real big gatherings.
Mm-hmm.
But I have some health issues, but some mobility issues, and I do go out, but a lot of times my siblings, some of them will come and they'll stop by, and everybody's just the one sister hasn't had a vaccine, but she does mask up and she try to do all the protective stuff, and I do allow her in, and
but she wears a mask whenever she's in your house.
She does.
Okay.
And she does.
Okay.
And
well, Dr. Reddick, do you have any offer of suggestions or?
Sure. So I think the reason, giving the rationale behind what you're saying is important. So just bringing up some of those things we talked about already and explaining why it's a big issue. So if you're having people come to your house, just setting those parameters and saying, hey, I need everybody to be vaccinated in your group that's coming. Has everybody gotten a vaccine? Yeah, we got a vaccine. And some people aren't honest sometimes and say, not just leaving it at that, but saying, okay, it's a big deal because, I'm on that prednisone medicine for my rheumatoid arthritis or for my lupus. That medicine makes my immune system weak. I cannot catch COVID. Like the doctor said, it would be dangerous if I caught COVID. It would not go well, probably. So I really need everybody to be vaccinated. I think people are less likely to lie about people they care about in those situations if you're given a rationale for it,
Yeah, and make it personal and help them understand.
Yeah, exactly. And same thing with the mask as well. If you do have a gathering with people and you decide to have people wear masks because you're going to be indoors more than 15 minutes, less than 6 feet apart, then and you're really concerned, you can explain to people, say, hey, I need y'all to wear a mask while you're over here because my husband's undergoing that cancer treatment right now, and his immune system's kind of weak. His white blood cells are a little bit low right now. He's going to try to stay across the room from people and stay away from people, not too close, but you never know what could happen. So I need everybody to have the mask on the whole time you're inside.
Sure.
Like saying that versus like, all right, y'all got to wear masks when y'all come over here, and just leave it at that. So.
there's a graphic that the Chatham County Health Department puts out. It's updated daily. It's the transmission index, and every time I look at it, it's bad news. The last time I looked at it in July, it was at 99, and today, or is it the 10th of December, is at 99. Could Dr. Reddick, could you give us a brief explanation of what this means and why this is important?
Yes. So they don't do it over the weekend, obviously. So we'll see if it's any better by tonight when they put out today's numbers. But the transmission index is essentially a measure about how much is COVID being spread right now. So they look at, like, per 100,000 people, how many new cases are we seeing each day? And anytime the number is above 100, that's considered the highest risk. That's what we call severe transmission. So the numbers aren't as bad as they were when we had that huge spike over the summer, kind of late July into August, September. Back then, the numbers were like 300-400. So the numbers dropped down considerably.
Oh, I saw it at 1,300 at one point. It was
oh my goodness!
It was like a couple weeks. This is like an index that has a 2-week lag, basically, and it was a couple weeks after July 4th. It was crazy.
Goodness, yeah. I think I blocked that period of mine out of my brain. That was terrible from a physician standpoint. But it was awful. And so the numbers dropped down, and they kind of correlated with vaccination rates. The vaccine opened up for different groups of people. There were a lot of people who were like, I'm not so sure about this vaccine, early in this year. I'm gonna wait a few months and see what happens to everybody else. Other people started getting it. The rates kind of started going up. When we passed over 50% of the country vaccinated, that's when we started seeing the numbers starting to go down. And towards the end of Thanksgiving, we started really seeing the numbers drop. So they dropped below 100, and then they got into the 60s. And people were like, oh my gosh, we're good. And then what happens when the numbers get good? Things start opening back up. People start traveling. People travel for Thanksgiving. People start to travel for like the holidays. And we're starting to see the rates go back up. And so and so the numbers have going up. And as you see, they're at 99 right now. So literally one more point, we're back into that highest risk possible. When we get below 50, that's when it's considered moderate transmission, which is kind of like middle of the road. Once it gets below 10, that's when it's like normal. And so there was an optimism, as you can see those first few bars where it was like 83 and then dropped to 68 and 66. If we had stayed at that rate, we would have probably been down below 10 like early next year, 2022, like in January. But as you can see, the numbers kind of took a sharp turnaround. And after the Thanksgiving break, a lot of people speculate it's because of all the travel that happened during Thanksgiving. We're starting to see the numbers go back up again. And again, the thing is about this is that reminder is that people catch COVID. That's true. But the problem is the deaths and the hospitalizations from COVID. And again, over the last 2 weeks, as you've seen that transmission index go up, we've had a 31% increase in COVID deaths during that time. So it's not just people are catching it and they're just fine or getting better. They're actually getting it, and a lot of people are actually starting to die again from COVID. And the thing is that we make a big deal about is, again, out of the people who are dying, the lowest number I've ever seen was 91% of the people who die are unvaccinated. In a lot of places, you're talking about 98, 99% of people dying are unvaccinated. In general, people do not die from COVID once they get the vaccine. And the few people that do are typically very elderly, like over 75, 85 years old, or have significant health problems or problems with their immune system. So again, like most people, and again, that's why it's, again, important, not just for you, but for the community as well, to get vaccinated, to protect against the people who are over 85, the people who are undergoing cancer treatment, the people who have immune system problems.
Now, you're one of your areas of specialty is community health, and I think one could successfully argue that public health has not been a priority, a national priority for some time. Do you see COVID-19 changing that?
I hope it does. My experience, to be just brutally honest, is that people tend to kind of they get a swell of support when something like this happens, and then within a few months of it ending, it's back to the status quo. I'll give you an example. For me, my personal bias is that I believe that healthcare should be universally available. It should be a human right. I feel like it should be the same way you just know, hey, I'm born in this country. I get my school paid for from kindergarten through 12th grade. It should be just a guarantee that you get health care if you're in this country. That's my belief. But that's what we've done during COVID, right? You go get your COVID vaccine. You don't have to show an insurance card. You don't have to pay any money. You just go and you get your vaccine, right? You just walk up and you get tested. I need a COVID test. I've been around somebody who's got COVID. I want to make sure I'm okay. You walk up to any health department, a lot of testing sites around the city, you can get tested. You don't pay a dime for it. And so I have a feeling that that's not going to continue. As soon as this pandemic's over, it's going to be back to square. I mean, look at the flu vaccine, for example. It's flu season, right?
I'm glad I was just about to mention that.
You got to pay $25 for your flu vaccine. You can't just go up and get it for free, right? But if it were to be a flu pandemic bad enough, when people start worrying about it affecting them, people in leadership say, well, I don't want to get sick. I can't get sick from your diabetes or your cancer, right?
Yeah.
I can catch your COVID. So all of a sudden, it's universally available, right? So
right.
I get a feeling that we're going to be right back to square one, unfortunately, once this is all over.
Well, it looks like we have a question from Beatrice. Hey, Beatrice. Why is the pediatric vaccine important in Chatham County?
Did you want me to take that one?
Yes, please. Yes.
And I know Beatrice. She's a big advocate in the Latino community. So
absolutely,
I've seen her at a lot of the events. So I've gotten to know her a little bit. So
she's one of our advocates, in fact.
Yeah,
one of the. Yeah, go ahead.
So the reason why it's important is, again, this is sort of a new area of the population that now has access to the vaccine that we found out is verified. It is safe for them to take. So kids between 5 and 11 can be vaccinated now. And the reason why it's important for them to be vaccinated is, again, because of that risk of spread. So there might be some teachers who are not vaccinated. There might be some custodial staff who aren't vaccinated. Or they could be people who are vaccinated, but they have some of those immune system problems I brought up several times. So they got vaccinated, but maybe the vaccine doesn't work as well for them. They're all at risk for passing it on to our kids. And so that's why it's important for the kids to get vaccinated, so that in case the people around them are not vaccinated, they are less likely to catch it. So that's why. And also so that they're less likely to spread it to other people as well. So it goes both ways. They're less likely to catch it from people, and they're less likely to give it to people as well. So that's why it's important. The other thing about it is that, we mentioned, I was kind of addressing the side effects of vaccines earlier, and how the side effects from the disease are way, way worse than the side effects from the vaccine. The same thing happens in the pediatric population. There's this unique condition that people were worried about heart inflammation with the COVID vaccine. It is something that does happen sometimes. It's not common. It's about as common as dying from eating peanuts, right? Some people do die from eating peanuts every year, right? So some people have allergic reactions to it. And so I'm not trying to minimize that. But it's only a couple hundred people we're talking about in the entire out of 340 million people. So it's not common. That's about the same incidence as this heart inflammation, a couple hundred cases of it we've seen in children. But the thing is that the reason why the vaccination is important for kids, even though I'm talking about a possible side effect, is because heart inflammation from COVID, the disease, is 100 times more common than with the vaccine. So again, you're talking about a couple hundred cases of heart inflammation with the vaccine. You're talking about several thousand cases, like tens of thousands of cases of heart inflammation from COVID, the disease itself. So in a weird sort of way, the heart inflammation thing that people were concerned about with the COVID vaccine in kids is actually a reason to get vaccinated, because that heart inflammation is way more likely to happen from COVID, the disease itself. And it's not just heart inflammation. There's also this multi-system inflammation that can happen as well from COVID, the disease, where you get liver inflammation, kidney inflammation, inflammation of all the organs all over your body. So that's another reason why it's important to get vaccinated, so that you don't get this heart inflammation, liver inflammation, all the other things that are way less likely than inflammation from the vaccine itself.
Now, we know inflammation is bad, I guess. So tell us a little bit, tell us why we don't want heart inflammation or inflammation of any of the other organs.
So let's kind of keep comparison of vaccine versus the disease. The heart inflammation that kids have gotten with the vaccine is way more mild than the one from the actual disease. The last time I read on this, out of several hundred cases, you're talking about a handful of people that actually had like severe symptoms, like were hospitalized or in intensive care. Most people just kind of have some temporary symptoms that go away after a little while. With the disease, again, we're talking about half of kids, a third of kids having permanent symptoms from this heart inflammation. So essentially, little children start functioning as if they have congestive heart failure. We're talking about getting short of breath, just walking short distances, not being able to play like they used to. and those kind of things.
Well, thank you. And this brings me back to Ms. Cassie. You said your granddaughter, well, you have family members who are not vaccinated. How old is the granddaughter you were talking about?
My granddaughter is age 14, and she has a brother. He's age 12. Mm-hmm. They have an appointment on the 20th, and I told the mother to speak with the doctor about it. Like I said, my daughter is 37, and I convinced her she got it. Mm-hmm. Now, if they were my children and not my grandchildren, I would do it. Mm-hmm. But because they're not mine, I can't, they're mine, but they're not mine. I can't do that. And I feel that it would be for their own benefit, as well as, their peers and the community as well. Of course, I'm not working now, and I did a lot of clerical paperwork. I worked in healthcare for 18 years myself, so I've been in the public health arena. I've seen a lot of things, and I know a few things, and, just like with the side effects, when I tell people, if there's any drug you're taking, if one person has a side effect of that medicine, they have to list it. That doesn't mean that a lot of people got sick or died from it. If one person, they're required to list that. So that could, be scary to you. You need to be aware of it, but it shouldn't make you afraid, especially if taking the medication or the vaccine is going to outweigh the risk, which we know, death could possibly be imminent if you don't get that, because of all the people that have already passed away from it. And a lot of them passed away before the vaccine was even available.
Mm-hmm. Yeah, and this brings us to risk, understanding risk, which is something that I don't think any of us do really well. And of course, there's a lot of emotion involved. Dr. Reddick, you've talked about the numbers, and those are really important in convincing, informing folks. But how do you get over that emotional part? Sometimes the numbers won't address the emotional fear of the vaccine, fear of any vaccine. I understand some people are just afraid of needles, and they don't want it for that reason. Is there anything else you can use? Any other approach other than the numbers and the data?
So in medicine, we use a lot of different techniques and kind of doctor-patient interactions to really understand what people's concerns are. So there's this concept of what we call motivational interviewing, where we're really trying to get at the heart of what motivates patients. What are they interested in? What do they want to address? For people that come in that are just hardcore, like, I don't want to even hear about the vaccine, don't even talk about this, I don't believe in it. If they're like that, I just say, okay, if you ever change your mind, I'm here. I want to talk. I'm here available to you. I don't believe in shaming people because a lot of this extent, like, it comes from a place of just genuine concern. There are some people out there that are trying to monetize people's fears and trying to take advantage of people's fears and make money off of it. I understand that. But most people I come into contact with who don't want to get vaccinated have genuine concerns, concerns about side effects and things like that. So the big thing is just not shaming people, but trying to understand where they're coming from. So just simple questions like, what are your concerns you have by the vaccine? Or what questions do you have? Or what things do you wish you could ask somebody without any fear of somebody trying to embarrass you or shaming you or whatever? What's a safe place to ask whatever you want to ask. No pressure to get it or not. I just want to make sure you have your questions answered. And that's where I kind of start with people. When I get that, a lot of times makes it easier to address it because people talk about side effects. And for some people, they want to just hear about experiences. For me telling them, hey, I've had a few thousand people that have gotten this vaccine, several thousand people that have gotten this vaccine, and only 2 people I know of that have had any kind of long-term side effects. But on the flip side, I've had several patients die from COVID. I had a patient die a few weeks ago from COVID. Patient who I've been begging for a long time to get the vaccine and just didn't get it, who died from COVID. And so, I tell them that situation. I say that, my experience has been what we see in the national data, which is that, close to half of people who get COVID a month later and they're still having symptoms. A third of them, 3-6 months later are still not back to their normal baseline after they get the disease, but nobody's doing that with the vaccine. I personally have not had a single vaccinated patient die from COVID. Every single patient of mine who's died from COVID has been unvaccinated. Every single one, 100%. And so when I tell people that often is their the thing that motivates them. For other people, it's funny. One patient I had who came in was like they were on the phone when I walked in, and they were like, "Oh, I'm sorry, Dr. Reddick, I'm about to get off the phone, but I was just telling this person like, I'm not getting that COVID vaccine. You didn't get the vaccine, did you?" And I was like, "Yeah, I got the vaccine. Like, I got it the first week it came out." And they were like, "What?" And the person on the other phone line started, I could hear them laughing. They were like, "Bye," and they hung up. And they were like, "I can't believe you got that vaccine. Like, you're always talking about not taking medicine if you don't have to, and like being healthy and trying to prevent stuff. And like, I'm confused. You never like that." And I said, "Well, that's for things like diabetes and high blood pressure that I can actually take control of that. I can get close to eliminating my risk by doing certain things, eating healthy, exercising, not smoking cigarettes, right?" With infectious diseases, you can't do that. Like, you can be the healthiest person in the world and you can catch an infectious disease. It doesn't work like that. That's why we get vaccinated. And that patient actually got that vaccine that day.
Wow.
And they were just stunned. Like, so sometimes it's just testimonial. It's people like, "Did you give your kids the vaccine?" "Okay, all right, I'll get it then. I'll give my kids." Like, they want to know.
Is it that easy? Sometimes, I guess it is.
For some people, that's what the motivational interviewing, because other people with certain things, they want to know that you, who they trust, maybe some people who trust me and my voice, say, "I want to make sure you got it and your kids got it before I get it. If you tell me you got it and your kids got it, then I'll get it." Or for other people, it's like, "Tell me about what your patients are doing, what their experience has been. Tell me if you've seen side effects." Everybody's different. You can never guess what people's trigger is. And that's why you have to just really talk to people and just open up your ears and listen to what people are saying to you. For other people, it's trust of the medical system. Like, they are like, "Man, I heard about the Tuskegee experiment and all this other stuff that's happened to Black people in America. I feel like this is just another scam to get Black people sick, the experiment on Black people." Well, the vaccination rates in other communities are way higher than they are in the Black and Hispanic communities. So if this was a trick to try to make Black people sick, it's failing miserably because everybody else is getting vaccinated much higher. And you actually have people trying to cut the line to get vaccinated when it first came out. So and also that in the Tuskegee experiment, everybody in the Tuskegee experiment was Black, right? You can just look at just the way things are set up and realize this is not a conspiracy theory. And so sometimes for some people, those kind of conversations make them more comfortable.
Sure. Well, and the other thing about Tuskegee is that a lot of people didn't know is that they were not injected with syphilis. They were untreated. And as a result of that atrocity, there are a lot more regulations on how you treat what a patient needs to know and how you must treat a patient. So I think you're right. It does. Education does really help. Now with Ms. Cassie, I as I hear you talk about your family and your approaches, I can tell that you are, you're kind of chipping away at the issue. I don't think you are guilting anybody. Well, how important is gentle persistence to being successful in getting people the information they need to make decisions on their vaccinations?
Well, I have some friends that are, vaccinated, and then I have some friends that are not. And when I talk to this one good friend of mine in the community that I've known, not as long, she's elderly and she's got health issues, but she doesn't want to get it. One of her fears is of needles, but I still try to dissuade her, but I don't as much. I just I want her to get it and be safe. But there's some people you can't dissuade. There was another family member that lived farther away, and her daughter was a healthcare professional. She was actually a nurse. And they were one of the first people that could have gotten the vaccine, but her daughter didn't. But she felt like her daughter was doing everything and being safe, but she gotten sick. And then and she ended up, with COVID. And when she did go to the hospital, with that same day, she actually died. And she was in her 50s. And this was my first cousin. And her mother, she actually was at home taking care of her. I didn't realize she was home for weeks sick like that. And so when she took her, she ended up staying at they tested her and she had COVID. They sent her home. She ended back in the hospital, but she ended up coming back home. And she ended up being fine, but later on, when she got well, she did get the vaccine. But all the other siblings, because there were more, my mother had some more sisters. I think I have an uncle that's 80, he and his wife, and another aunt that's 70. They all got there. So, they're all doing fine. And then I have another cousin. She works in healthcare in that same area, and she's in her 30s, but she refuses to get the vaccine. She has a small child, a husband. Some people, and plus she sees what's going on, but it's some people that they just refuse. They're just stuck. And I don't ever talk to her, but it's like some people you can't convince. And just like when I hear on the news, the national news, they said that the hospitals are filling up with COVID cases again. But they saying the majority of these people are people that are unvaccinated. So, that's something, telling people something right there that you need this. And also I see that how overwhelmed the healthcare professionals are, because they're on the news. They're saying we're just overworked, we're tired. And, some places they're even sending in the National Guard to help them.
It certainly is a huge challenge, and I appreciate both of y'all for being on the front lines. Both in the doctor's office and in neighborhoods, making sure people have access to the information that they need. Just a little brief thing about the Community Health Advocates Program. We have just instituted this program. The idea is to, as I might have mentioned a little bit before, is to reach out, get people who are embedded in their own neighborhoods, have friends, have influence in their own social circles, and ask them to share information. We're not really hardline trying to convince, trying to guilt people or force people into getting a vaccine. We, especially in African American and Latino communities, we want to make sure people have access to the information and access to the vaccine, whether they want it or not. We want to make sure everybody has a way of getting it if they want. And speaking of community health advocates, Beatrice has another question, and this will be a perfect one to wrap up with, and that is, Dr. Bonzo, what would be the one thing that we could do differently in 2022 to mitigate the misinformation about COVID in our community?
That's a great question. I think it's got to be a grassroots kind of like community level, local approach, to be honest with you. I think we tend to look at things as broadly. So you turn on the CNN or something like that, and you see like national news, but really every state has different community transmission indices. Different ones have different laws and different mandates and mask mandates or whatever. So it's really hard to generalize in the entire country. In addition, I kind of mentioned how a lot of the major news organizations, the big ones, are really just there for ratings and kind of trying to prevent provocative arguments, really. These kind of conversations like we're having here today with WATERCOOLER, like those are the kind of conversations that tend to be more, all right, we're not here to try to have a big showdown or get some sound bites. We're here just to try to get information out, right? So I think that kind of thing has been what's been most effective. For me, going to speak at churches or community events on the weekends, like those are the times where I've had a much better response. Compared to just somebody turning on their TV and thinking they're just going to see something that's going to give them great information. So for me, I think for 2022, continue to do these kind of conversations at the local level, community levels, the grassroots level, where people can just kind of ask basic questions and kind of get this straight answer to a lot of things. For me, again, I've had a lot of these events where I go and I was speaking at a church one time, and this was one of the most simple kind of convincing somebody to get vaccinated I've ever seen. It was a guy who I was at a church, and he was convinced that the vaccine was what we call the mark of the beast in the Bible. Like he thought it was an evil thing that was a sign of the end times, and if you got the vaccine, you're going to be kind of doomed in terms of your eternal life. And I asked him, I said, okay, well, I'm not going to argue that point, but the mark of the beast has to be placed where? He said, on your right hand, on your forearm. I said, why don't you go get your vaccine and tell them the man is in my left arm? If they tell you no, it has to be in your right arm, then I was wrong and come back to me. And he was like, that's a good point. I got a message from his pastor that he called the next day excited because he went and got his vaccine in his left arm. So
Oh, wow.
sometimes just little basic things like that, you'll never get that on a large national level, right? Like I don't know if there are very many people like that. But that was one example. Like just somebody you can just talk to on a local level. You know, I'm around, people know how to find me. I'm on social media. I get all kinds of DMs on Twitter and Instagram from people with questions about the COVID vaccine, and I'll answer them, you know? So, so those kind of local things with people that they know, people know you, you know, Ms. Hoskins, I run to people all the time who work with you, Beatrice and other people that we know around, trusted voices like those. That's what we need going into 2022 to help combat a lot of the misinformation and the kind of provocative sound bites that you get on a lot of national organizations.
Well, Dr. Reddick, I know that Pastor Brown is smiling down on you, saying, "Oh, those Sunday school classes came in handy,
right.
didn't they?" And, well, as I'm gonna ask Ms. Cassie to wrap up, because as I said, you are and as Dr. Reddick said, it's kind of in your hands, because we as we work to get the information and awareness out. Would you like to wrap up and with any last comments?
Yeah, a comment that I have was that when I first got my vaccine and I was ready to get it, but I had to wait in line for that age thing. But my pastor called me and she said, her name is Pastor Marsha Buford, and she's the pastor of House of Favor. And she said, well, Joyce Hall Church out there, Living Hope in Garden City, they're doing the vaccine. And she said, Miss Cassie, have you gotten yours? And I said, no. And I said, but I'm ready. And she said, well, they're doing it. Anybody can come. So I called about 4 or 5 people. I went. My daughter was working that day, and she didn't get off the 3, and they were still doing it. I kept bugging her, you going? And when she got off, she went. So when I got there, some of the people I called met me there. We got our vaccine. It's a good thing that a lot of the Black churches were having the vaccine and people could go, and that made it easier. And even if it wasn't the church that you attended, because they were in connection with other pastors, they called, and the pastors called their members. And of course, it wasn't like a rush to go, but it was like, if you want to get the vaccine, go ahead. And so that was very helpful, doing that.
Mm-hmm. So yeah, we worked with several faith communities, and we aren't the only ones. I believe the county has as well, and that's been really, really useful. And I hope we can continue those relationships and expand to some secular areas so that we can be sure that we reach everybody. So thank you so much, both of you. I wanted one quick thing. If we could, Dr. Reddick, can we put your email address up? The Mercer email address.
The easiest address, the one that's kind of on my phone that I can get, is you can actually just email me at Bonzo, Bonzo, at drbonzo.com and spell out the word doctor. DOCR.
I'm going to put this, ask this that we can put this in the chat or put this on the ticker if we could. Bonzo at Dr. Bonzo .com.
Bonzo at drbonzo.com.
Okay.
Yeah. And if you forget it, you can always you can go to my website, drbonzo.com, spell out the word doctor, and there's the link on contact us. You can email through that as well. Yeah, that's it right there. That's perfect. And, and I meant to say this at the beginning. I always like to say a disclaimer is that I do not get any money for any COVID vaccine talks or COVID-19 talks that I do. I never have received a dime or a penny for it. I do not own any stock in Moderna, Pfizer, or Johnson & Johnson, because sometimes people always ask me that as well. Am I just here making money off of this kind of thing? I have not made 1 penny off of COVID-19 vaccinations, and I will refuse to do it. I knew I probably could have bought some Moderna or Pfizer stock back last year because I knew the vaccine was coming, but I deliberately did not do that because I did not want anybody to ever think that I was giving this information to try to make money off of it. So.
Mm-hmm. And that's some of the ethical, well, we know that you're an ethical guy anyway, but those are some of the ethical restraints that came about as a result of Tuskegee. So, yeah. Well, thanks again. This has been a really fruitful, rich conversation. It's so good to spend time with both of you. And I think we could have gone on for another probably half an hour or so, but let's cut it off here. And thank you to everybody who's joined us this morning. You can always reach us at healthysavannah.org. And if you're interested, especially if you're interested in joining the community health advocate program, we would love to talk to you more about it. And again, thank you and have a great week and stay safe.
Okay.